she's been having issues for sure.
Oh,
All
God.
that to say,
Mm.
that unfortunate situation did afford me the opportunity to work with the National March of Dimes. And it's amazing to me how many women have gone through that, but has never had the opportunity to properly grieve.
Yeah.
Because like people said to me, it's okay, you can just get pregnant again. You can just have another one. People are so insensitive.
Insensitive.
Yeah, so insensitive when it comes to infant loss and stillbirth and miscarriages. I did get pregnant with my son, my oldest son, 3 months later, um, and had a wonderful pregnancy. Was very, it caused a lot of anxiety
I
because
bet
of
it
when
did.
I lost her. Um, it just it was tough, but he was born and he was amazing, and he was actually the biggest baby I've had. His head was so big, oh my gosh, to push out. But he was healthy, and yeah, so it was helpful. So
Did you ever find out like what caused your
yeah,
baby to not live?
so she was actually perfect. There was nothing wrong with her. I had a unfortunate situation called placental deficiency, and my placenta actually just quit working. And so when your placenta quits working, it doesn't feed the baby,
Right.
and baby can't live with no nutrients. So that was the cause of death. Other than that, she was perfectly healthy.
Perfect.
Um, no chromosomes missing, no anything. And so I want to address, someone asked the question in the live earlier, um, did I feel the baby not moving? And this is where I challenge women to know their bodies, and I challenge women to trust their intuition. Um, my last appointment that I went to prior to finding out that I had to have her early and that she wasn't going to make it, normal heart rates for babies, when you're checking their heart rates when you're pregnant with them, a normal heart rate is, I believe, heartbeat 120, in between 120 and 160, if I'm not mistaken. That's normal. And she had always been high 150s, always. The appointment before I found out that she wasn't going to make it, her heart rate was like 125, 130. And I promise you, as God is my witness with everything in me, I asked that nurse, is that normal? That seems really low.
Hmm.
She was like, it's within the normal range between 120 and 150, 120 and 160. And I was like, are you sure? She's always really high. She was like, she's probably just sleeping. Literally, that was the first sign that something was going wrong.
Yeah.
And I dealt with years of guilt
I was
after.
going to ask about that.
Yes, I dealt with years of guilt because
Mm.
I didn't trust my intuition. And
Yeah.
so the whole, what if I had said something? What if I had just pushed a little? It was so hard. Like that made the grieving process that much harder for me, um, because I knew it. I knew something was wrong. Like it just was not normal. So I
Right.
challenge women, like when it comes to your maternal health, advocate for yourself. If you think something is wrong, make some noise until they check it out. And that is one
Right.
thing that I literally I advocate for. I'm a patient advocate. I am a patient ambassador for a number of different, um like I don't play. Like we have to be heard. And the infant mortality rate is really in a bad place amongst African American women. We
Yeah.
have to be proactive about our health, and we especially have to be proactive when we are carrying these babies because we're not heard the same. And so that is
Yeah.
something I took up as kind of a mantle or a mission. And so when I work with the March of Dimes, I'm still, in contact with them today. I'm very serious about that. I'm like, trust your intuition, trust your gut. it's there for a reason. After I had my son, I got pregnant again as when he was 6 months, because I told y'all we were not the greatest um with birth control.
Mm-hmm.
This time it was a boy. It was another boy. So at this point, I had had a girl, a boy. Now it was another boy.
Mm-hmm.
And we went to, where did we go? Branson, Missouri. There's a theme park close to there, but we took the two littles because, like, again, I had two at this time. CJ was a little baby, but Kayla was about 2 years old, so she enjoyed it. All of my family went up. We had a good time that weekend. I was about 5 months pregnant with what would have been our second son, and we came home, and I began to have contractions at 5 months. And we went to the hospital, and I had to give birth to another baby that didn't make it. And most people don't know that story, because
I
that
knew
baby,
about Autumn. I
I
knew
know,
about Autumn.
it's too much for people to digest. And so some things I don't get into, but since this is what this platform is, I'm being honest. And because that baby did not weigh enough, they did a medical D&C.
Yeah.
And
5 months.
I didn't have to go through necessarily the funeral
Delivery.
right of it all, but the trauma, as you could imagine, was a bit much. At that point, I sank into a pretty bad depression, and I gained a lot of weight. I just couldn't figure it out. I'm like, it's like, what is going
What is
on?
going on?
Right. And fast forward, I ended up getting a pretty serious birth control method put in place that blocked me from getting pregnant for about 4 years. We got pregnant with my youngest son, who was amazing. Fast forward, I wanted a girl so bad, and I think it just always stuck with me when I lost Autumn. I was like, it would have been nice to have another girl.
Yeah.
I'm one girl and two boys deep. I think it would be nice to try for a girl. And we tried, and we succeeded. And I found out I was pregnant with my youngest. In this time, Terry, life is lifing. I found out that the kid's dad had been having an affair. When I was pregnant with our son, I found out that he had also impregnated our nanny. And so our sons are about a month apart. I actually would have had my son about the same time she had her son, but because of all the stress, I had him prematurely.
Yeah.
So he was born 5 weeks early. And so their birthdays are separated by 5 weeks, and he was born in December and his half brother was born in January. I suspected but did not know for sure until a few years later when I found out I was pregnant with my daughter. She filed paternity. And so the stress of going through these paternity cases, because it's just crazy that I've lived through this stuff. Sometimes talking about it, it's like, girl.
Winter, do you have a book out?
So I have a book about all this stuff? No, I don't. I need to.
A memoir, like about your life.
I don't have a memoir, Terry. I don't. I don't have a memoir yet. I don't. But so in the midst of me finding I was pregnant with my daughter, I was also going through paternity with this nanny, but I also was going through another situation where I learned he had also impregnated another female. So this was two outside children, and I'm pregnant with my youngest. All of this stress.
And you're married still.
We're married still.
So you're the wife.
I'm the wife. I'm the wife. And all this stress, all this drama. I am literally in so much, like, I don't even know what you want to describe it as. It's just craziness. I went to the doctor. I was about 5 months. I want to say a little bit over. I was about 24 weeks. So I went to the doctor and my blood pressure was high. I had never dealt with blood pressure ever. And this was my fourth child. And she was like, Winter, I am going to put you on observation. She said, because it's just, it won't go down. So she sent me home. The next day I came back. She was like, listen here. I hate to tell you this, but you may have a baby today because we cannot send you home. This blood pressure is out of control. I could not explain to this lady everything I was going through and why my blood pressure was so crazy. Like, she was like, what is happening? Like, this is crazy. My blood pressure, Terry, was 202 over 133.
How far along were you again?
24 weeks. So from that point, I mean, I couldn't even go home. She was like, you need to call. Everybody need to call. You're going straight to the hospital. Fortunately, our hospital was across the street. They had me go over there. They admitted me. And they were like, well, looks like you're going to have a baby today. And so they could not handle, because I live out in Virginia, the hospital that I was at could not handle the type of preemie that she would have been.
Yeah.
So they actually airlifted me to Fairfax Hospital because they are actually one of the best neonatal hospitals in the country. So they airlifted me to Fairfax. My doctor at the time, Dr. Chowdhury, I'm going to shout him out because let me tell you what. Let me just back up. Can I just say this? This is how good God is. Because I don't want to just be all doom and gloom because y'all, I've been through a lot. But when I tell you, I still smile. I don't have a negative bone in my body. I see the goodness in everything, and I still see the way that God works. Let me back up. Dr. Stokes, God bless this man. Dr. Stokes was my OB at the time. I actually went to see him for my first official OB visit. I was about 22 weeks, maybe 20 weeks. I'll say 20. Let's say 20. 20 weeks. I finally had my first OB visit. I was excited to have Dr. Stokes. All of the wives saw Dr. Stokes. He was a Christian doctor, so I was excited about that. And so we had our appointment. We were excited that it was a girl. He was going through the procedures that would happen over the next 20 weeks leading up to the delivery. And we got ready to wrap up our appointment with him. And all of a sudden, he got real serious. And he said, do you mind if I pray with y'all before you leave? I said, no, sir. Go right ahead. He bowed his head and he started to pray. And I don't remember everything he said, but I remember him saying this. He said, God, give every doctor that is attached to this pregnancy the wisdom and the knowledge that is needed to make sure that this baby arrives healthy and whole. Please cover her and keep her so that both baby and mom are alive and well. I never saw Dr. Stokes again.
The power of prayer. Because do you believe in angels on earth?
Absolutely.
Okay, so that's who that was one of them.
I never saw Dr. Stokes again. When I was admitted 4 weeks later, Dr. Stokes was on vacation. He had to give like rights over to another doctor to take care of my case in his absence. She said, you're going to have a baby today. She admitted me. They did not have the capacity to cover that type of preemie. They airlifted me to Fairfax. She said, she came to see me. She said, Winter, she said, I'm going to transfer you over to Dr. Chowdhury because I trust him and he is one of the best neonatal doctors in this country.
Okay.
She said, if anybody can deliver this baby and make sure she is okay, he can do it. I said, I appreciate that. We got to Fairfax. Dr. Chowdhury came in and introduced himself. He said, before we just go ahead and deliver this baby, I'm going to run some tests and I want to get a good, clear ultrasound and see how big she is. Because if she's not as big as I need her to be, you're going to get comfortable because you're going to be here a while. He ran the ultrasound. This baby was tiny. She was not even 1 pound. And he came back in. He said, I just got the results back. She's not quite 1 pound yet. So, in efforts to save her, we are going to prolong you. And so you're officially on hospital bed rest. That means you don't go anywhere until you have her. That could be 2 weeks, 10 weeks, or 16 weeks until you're 40. But that's what it's going to be. So I ended up having her 6 weeks later.
So she stayed and grew
She
6 more
stayed
weeks.
and grew, and she cooked 6 weeks more. And because I was in the hospital, Terry, let me tell you how good God is. My placenta started to act funny, just like it did with Autumn. If I had not been in the hospital, I would have had the same result. Mm. And I like to say that God put me in the hospital to ensure, because
God sent an angel through that doctor.
I'm like, if it had not been for the high blood pressure, if it had not been for certain decisions that were made, if it had not been, we would have had to bury another child. But because I was there, and because I was on hospital bed rest, they did ultrasounds twice a week. Every week they would roll me into the hospital. Like, that's just what it was.
Yeah.
And so they ended up doing an ultrasound, and they said, listen here, it's acting a little funny. If it keep acting a little funny, you're going to have a baby, period. She's big enough. She'll be tiny, but she's big enough to where she can honestly be just fine. And I said, okay, do what you need to do. So she cooked for 6 weeks. I was 29 weeks when I delivered her. She was 2 pounds, 8 ounces. I remember the nurse bending down to me and saying, she's little, so I don't want you to be alarmed. Her lungs are not that big, so she may not cry, and that's okay. I don't want you to think that something is wrong. I said, okay, yes, ma'am.
Right.
And so I had her. When I tell you that baby came out hollering, now let me tell you, hollering for a 2 pound ain't the same as a hollering
ain't
as
the same.
But when I say that baby had chirped with every bird chirp that she had mustered in her little lungs, she came out fighting. Now they of course swoop her away to take her into NICU, and she had to have CPAP because their brains are not fully developed. It's all the things. She has to have a breathing unit. But I was just so grateful in that moment. She fit in the palm of her dad's hand. I didn't get to hold her because they had to take her, but she was good. So she actually stayed in the hospital for another 6 weeks, 8 weeks. Now typically they stay until their 40 weeks gestation, which meant she would have had to stay for 11 weeks. When I say she passed every test, she was nursing. They took her off every machine. We brought Autumn home at 3 pounds, 9 ounces.
Autumn?
Yes, her name is Autumn Grace. So she is named after her sister, because God keeps his promises. And I thought they were insane. We had to go shop in Walmart, my mom and I, to buy doll clothes because she couldn't fit anything.
Yep, doll baby clothes.
She had to wear doll clothes. We had to order her Pampers. People don't know that there's a such thing as an XXP, which is an extra preemie diaper.
Mm-hmm.
That was her size. We had to order them from Amazon. But she was amazing. She has met every benchmark. In fact, when she was in kindergarten and we moved her into first grade, the first grade teacher called us and she said, I need to call you guys in for a parent-teacher conference. Right. And I was like, okay. She was like, I know she's a preemie. I see her chart. I just want to go over some things with you about her. She's like, but you guys need to come in for this. And I said, okay. So her dad and I went in and she said, I had to bring you guys in. She said, because I have never had this happen to me. And I've been teaching for about 15 years. She said, I read her chart and I saw that she's been followed by the preemie clinic and that she was expected to have delays. She said, I don't know what you guys have done with her or how you have prepared her for first grade. And, obviously she went to a great kindergarten school. She was in private school at the time. She said she reads on a third grade level. She could have skipped first and second grade.
Look at the amazing work of God. You can't tell me. Listen, people who don't believe in God, whatever, you
y'all
can do
don't.
what you do. But you can't tell me
Yeah.
that the Most High isn't who he say he is.
Yeah.
You can't.
Absolutely.
Because you can't explain what you just explained this last hour. You can't even wrap your mind around that in an earthly realm like that. Those things don't just happen.
No.
The doctor that showed up, that doesn't just happen. And then he didn't even deliver. You know what I mean? You never saw him again.
Never saw him again. No,
That
this is
doesn't
a true
just
story.
happen.
Never saw him again. Never saw him again. But we were able to, and they were able to actually pin down like what was going on. And so she was like, you know, you're fertile. You can have as many kids as you want, but in the future, this is what you need to do to prevent experiencing. We had never found out prior, but their recommendations, even going to the hospital, put me in contact with the right doctors that were able to pinpoint the reason why I was having the issues prior. And so she was like, go be fruitful and multiply. If that's your plan, like you should be fine from this point forward. I was almost 35, I want to say. Nope.
When you had the last one?
Nope. I was 29 when I had my last one. But I actually went through my divorce at 35. So we've gone through a lot in this span. So you guys obviously know I experienced infidelity. So you guys know that's trauma.
Right.
I was still very committed though, because I had this, good old church woman mentality.
I was going to say, it's about how you were raised.
Yes, absolutely.
Yeah.
I was going.
So did you divorce him or he divorced you?
I divorced him, Terry, and I did not divorce him. I did not divorce him until I had an experience. Because of all of the stress, it really broke my body down. I actually woke up one morning and I could not walk. This was in 2012. So I had Autumn in 2010, 2 years later. In 2012, I woke up one morning and could not walk. My ex-husband at the time was carrying me back and forth to the bathroom. And we could not figure out what was wrong. So I went to all these specialists and they figured out that it was a stress reaction and a PTSD reaction to everything. Like, I have named a lot of things.
Oh, so my goodness. That's why I said like this. I feel like we have gone through a movie.
Yeah, we have. So this was 2012 and 2014. I mean, we have separated. We have gone through couples therapy. I am bitter. I am angry. I am.
Is your bitter and angriness strictly tied to the infidelity and because he had 2 babies on your watch, right?
Absolutely. Yeah.
Okay.
It's tied to all the above. It's tied to feeling like I gave my youth to this person, and
you did,
and we aren't respecting. I've given you 4 kids. Well, more than that. I've given you.
You had 6 babies.
Yes. And so I am heartbroken. I ended up going to the hospital. This is 2014 because I am having what I think is heart palpitations.
Yeah.
My whole system shut down. I'm admitted into the oncology unit. They are trying to figure out whether or not I have cancer. I went from 141 pounds, Terry, to 118 pounds. My blood pressure is through the roof. My functions are starting to shut down.
Winter.
I'm so serious.
The stress is about to kill you.
Absolutely. Our church is running meal trains. My mom and sisters have moved in to help manage 4 kids now at this time. And I am in this hospital. And I remember the doctor coming in and saying, you know, I have to be honest with you. If we cannot get this under control, you are not going to make it. So I don't know if you have any arrangements in place, but you guys need to talk about things. He said, we are doing our best to try to figure this out. But he said, we just do not know what's going on. So I remember going to bed. I was so mad. I was in that hospital by myself because the kid's dad had to go back home because he had to go to work. He was still working at this time. And I was just so mad. I was in the dark. And I asked God, I said, is this really what my life is going to end like? Like, I just don't understand. I've been
Right,
through
you're like,
so
this
much.
can't, this
It's
can't
not
be it.
fair. Right?
Yeah,
Like, I'm like, this is so not fair. And I can't really explain like the real like heart-to-heart conversation that I had between me and God that night. But I needed to like relieve myself of every ounce of, I just had grievances. Like all the way back to losing Autumn Lynn, I had grievances with God. I really did.
Yeah. Understandably so.
I was pissed. But when I tell you that encounter changed my life, and I don't know how to explain it. I just felt like he heard me. And I said,
he heard you.
I did, but you know, based off of my history, I wasn't so sure he heard me.
You like, Lord, are you what? Like, what?
Are you working up there?
Right.
I remember saying, if you just get me out of here. You know, we all have these moments, I feel, at different points in times, but this was personal for me because I had 4 babies that would have been left without a mom. And I said, if you will get me out of here, I promise I will forgive and I will let this go. But if this doesn't work out and I find out that he cheats again, please give me the strength to walk away in peace. My blood pressure at this point had always been about 217 over 140 something. Stroke numbers. I remember the doctor saying, if we can get these numbers down, you are going to be out.
Yes.
I was on 2 different blood pressure medications through the IV because I couldn't keep any food down and I couldn't eat. I didn't have an appetite. And so 2 different blood pressure medications couldn't keep it down. For 2 weeks, I was in the hospital for 2 weeks. And I had this conversation. A nurse came in shortly after to check my blood pressure, and my blood pressure was high again. It was like 2 something over 150. It was higher. She said, sweetheart, you're scaring me. She said, how many kids do you have? I said, I have 4. She said, do you believe in the power of prayer? I said, yes, ma'am. She said, do you mind if I pray for you right now? I said, no, ma'am, I don't.
You've heard that song before.
Okay. And she said, God, I do not want to see her again. She has 4 babies that she needs to raise and she needs to go home to. And she said, if at all possible, can you please touch her body? And please heal her. And whatever she needs to be made whole, I pray that you make her whole. But I pray that you give her beauty for ashes, and that once she leaves this hospital, that the life that she leads will not compare in the life that she's leaving behind. She gave me a big hug. I mean, I was bawling. I was sitting in that hospital bed just crying my eyes out. She left, and I didn't see her again. The other nurse came in that morning. She checked my blood pressure, and she screamed and ran out the room. And I'm like, oh, Lord. You know, She came back in with the doctor. She said, I had to get another blood pressure machine because I just checked it. And that blood pressure is 120 over 79. And I ain't seen that in 2 weeks since we've been done had you in this hospital. I just want to make sure my blood pressure machine isn't broke. She went and checked it again. It was normal. The doctor came in and she said, if you can keep this up for 24 hours, you can go home. And I'm telling you, I just literally, I raised my hands in that hospital. I just thank God. I was like, Lord, thank you. 24 hours later, I was discharged.
That's what I was going to say, Lisa. That was another angel. You, ma'am, you, Winter, you, like a lot of us, but you have had angels placed around you in your life for so long.
Absolutely. I believe that that God has just covered me. So I tell people all the time, I don't worry about anything. I don't worry about naysayers. I don't worry about what people have to. I'm like, you got to contend with the God who loves me, not me.
That's right, girl.
I'm his. You gotta deal. You take that up with him. Take it up with Jesus.
Take it up with the Lord.
It's not, but I remember my ex-husband at the time, it was the kid's dad. He picked me up from the hospital and I just turned and I looked at him and I said, I forgive you. Now, when I tell you, Terry, that man looked at me, his eyes got so big. He probably thought I was crazy.
I know,
but
he probably did.
It with everything that was in me.
Yes.
And I said, I've decided that if I'm going to stay, I'm going to forgive.
I'm going to forgive you because that's what we're required to do.
But I promise you that if this happens again,
I'm out.
I'm gone. Terry, it was not even 6 months later. Now, people, I don't even talk about this, but for about a half a year, I was on chemotherapy-like treatments. My whole system had to be rebuilt and revamped. Mm-hmm. And I got discharged just in time to see my baby boy graduate from kindergarten. But I was so thin. I have a picture of it. I had just cut my hair. So I had like a little Halle Berry haircut, but I had to wear a mask. This was before COVID. Mm-hmm. I had to wear a mask because my system was just shot from all the medication and the treatment. Not even 6 months later, I found out he was having another affair. I didn't even argue. No, I'm so serious. It was not one argument had. I looked at him and I said, I am done. You do what's right by me and you do what's right by your kids, but I am done. And that's a great way to conclude, because when I say that God has been faithful and he has kept his promise to me, I can't even count my second marriage. And it's unfortunate that it happened. But when I say God has always used every single negative thing that I've been through for my good
and turned it into everything for those of us who belong to him. So if we belong to him, all of us don't belong to him now.
No.
There's some of these people out here ain't his.
I can't speak for them. But
we can't speak for them.
I can't speak for them. But for those of us who do, I always say when I speak, and I have had the privilege of speaking to thousands from all over the world. Yes. Nothing is ever wasted, and God wastes absolutely nothing. But he's a promise keeper.
Everything that the enemy intended to take you out, God used it and turned it into something magical.
So for a long time, I literally was posting, and I would say, people look at the things that happen in my life now, and I don't know what people think. People may think I'm just lucky, and people may think, oh, I know the right people, or I'm in the right places. I'm like, no, it's due me.
It's the favor from the Lord.
It's absolutely due me. I have literally lived through hell
Yes,
and
you
back.
have.
And I don't take it for granted. I do believe in the power of why not me. We always ask why me, but there's a power in why not me,
Why not me?
because there's a blessing that comes in the why not me. And I remember my pastor's wife used to say, the level of your low dictates the level of your high.
That'll go over some people's heads.
The level of your low often dictates the level of your high.
Absolutely.